What makes a pandemic? The media creating panic? People on TV wearing spacesuits?
You bet. You see that all the time, and it may be happening again.
And I think sometimes just the word panic, using the word panic makes people panic.
Or just seeing somebody in a spacesuit in a hospital is going to scare you, particularly if you're the patient.
So is the spread of Ebola, which is the hemorrhagic fever, really an international public health emergency as declared by the World Health Organization? Something that we need to ask ourselves. And do we really have to worry about Ebola coming to the U.S. now that we have a couple of patients here that were brought from West Africa to Atlanta, to Emory Hospital? You know, we had similar so-called emergencies for the H1N1 swine flu and for SARS. And what happened with them is that the scare turned out to be much about promoting vaccines. Now, so far, we're using experimental drugs, and we don't have an approved vaccine for Ebola. But you can't help but ask yourself and wonder, could this experimental drug be somehow leading to profit from drugs and vaccines down the road?
Oh, that's what's happened in the past for sure. And we may be on that same track again. But before we get into all that, let's talk a little bit about what Ebola is. You know, there are two viruses. One is called Ebola and the other Marburg, and there are also three others in this family, this Ebola family, that cause this terrible disease that people are dying from. So we don't want to take this lightly, that it's not a serious illness. It's a very serious illness that may have mortality between 50 and 90%. So that's something to keep in mind. But where do we get it? There's a reservoir in Africa almost exclusively from African monkeys, chimps, primates, and the reservoir is the fluids.
And pork and bats?
Can come from, yes, a lot of animals. And it's the body fluids from dead animals and the reuse of needles, which we do in some places where we don't have enough needles to go around, that leads to spreading this.
Oh boy, that's just such a problem. And it's also how the people handle the meat and all that kind of thing. So let's talk about the incubation period.
Well, that's interesting because normally it's 5 to 10 days, but the extremes are from 2 days to about 3 weeks. So we're looking at a huge span here where there are no symptoms at all until the disease starts.
But it's not really contagious until after you have the disease and,
right.
And you're very sick.
You'd have no way of knowing if you even have it until that incubation period is over. So if you had just 2 days, you'd know real quick. But if it was 3 weeks, there's a lot of places you could go in the meantime where it could be spreading this all over the world.
So the main people that are getting this are people that are family members and the healthcare workers, because they're dealing with these people that have it, and you can get it from fluids, bodily fluids.
Absolutely. So what are we talking about here? I mean, this is a serious illness that no one wants to discount. Call it an epidemic. There are only something over 1,000 deaths that have occurred, and they've all been localized to Africa. There haven't been any deaths anyplace else. There have been a few cases in the Philippines at some time in the past, but it hasn't been anything that's been really spread anyplace else. Now, how can that be, Vicki?
I know, it's pretty interesting because when you think about people getting on an airplane and they're not feeling sick yet because they don't have the symptoms.
They're in
and
the
if they did
incubation
have it, if they'd been exposed, why wouldn't they be getting after they got here?
And, of course, it's been spread all over the world because people who have Ebola have left the areas that are indigenous in Africa and gotten on planes and gone everywhere. There's no way that couldn't have happened. How would you ever know? And you also have to ask yourself the question, why hasn't it spread to all areas of Africa? I mean, it's just localized to a few areas. So something about the epidemiology of this disease makes no sense.
Well, the other thing is it really a pandemic if out of 2 billion people in Africa, 950 people have died over a pretty long period of time. I don't know, since February?
Well, look at the mortality from influenza. I mean, it's supposed to be that there is something like 36,000 deaths a year. Of course, that number isn't right, but that's a huge number compared to 1,000. Now, just because more people are dying and it's a more serious illness if you get it, doesn't mean it's not serious. I mean, that's true. But call it an epidemic, maybe a local epidemic, call it a pandemic, no way. And to expect a pandemic, absolutely not. The disease has been around at least since 1976 by the way we have measured it. But and it's probably been around a lot longer than that. Why? It's had plenty of opportunity to spread. Why hasn't it?
And remember the anthrax scare? There was fear that it could create bioterrorism.
Mm-hmm.
Now there's some people talking about Ebola and how that could be used as bioterrorism.
Well, that may be true, and it's possible that that could be produced by a center that has access to this virus, and it could be spread if that's what the intent was. But the big thing here is what we've got is a scare tactic. We have no evidence that the disease ever spread, and it's had plenty of time to do it. So the bottom line here is yes, it's a serious disease. No, it is not a huge epidemic. It is certainly not a pandemic. And to think that this is something that's going to cause a lot of deaths worldwide is nothing more than anticipation and fear.
It's definitely a problem in West Africa and the areas that they've described. So the people there have a right, I guess, to panic.
Oh, absolutely.
And they're closing down some of the hospitals. The healthcare workers are afraid. People are fleeing. When people die, they don't want to keep the bodies in the house because then they'll be quarantined, so they throw them in the street. And there's a lot of panic there, which you can really understand. But the question is, do we need to panic about it spreading internationally?
That's right. And that's what the gist of this is about. Yes, a serious disease. No, it's not an epidemic. Certainly it's not a pandemic. And to think that it's going to spread global is just somebody's imagination running wild up to this point.